So it's very important to have proper screening before getting the transplant, because we know that after the transplant, whatever there might have been that's a small problem we put into an immunosuppressed environment will become a big problem. So we want to get rid of precancerous lesions before a transplant. And as you know, any transplant workup includes things like colonoscopy, chest X-ray, and so on. And that's the reason. If there's something there, we want to know about it before immunosuppressing our recipients. Doing what you're doing, getting educated. I mean, there's nothing more empowering than knowing you don't want to worry, but you want to know why you're doing things and why things are the way they are, so that you can improve your health. Then, for some of the cancers, there are preventive things we can do. We'll talk about, for instance, sunscreen in transplant recipients to avoid skin cancer. It works, Post-transplant screening, why do we want to screen? Well, in some transplant recipients, they've had it. They've had enough health issues, medical care, they're done, they have the transplant, and they don't want to find other problems. But that's not scientifically sound, because a lot of the cancers that we can develop, if we find them early, are treatable with close to 100% cure. If we wait too long and the cancers get advanced, then we don't have options. So screening isn't looking for problems, it's important health maintenance, health and well-being. And then, if a cancer is diagnosed, it doesn't mean the end. I mean, we have remarkable therapies available for so many today, even in complicated situations of immunosuppression and having organ recipients and all of that. It's important there, of course, to have a really good team, and we'll talk on that. I guess we'll talk on that now. So in terms of the screening that one does before the transplant and the regimen of preventive things after a transplant and when a cancer is found, the treatment, the team approach is so incredibly important. So the transplant team, sure, those are the folks that know the most about cancer in a transplant population exposed to immunosuppression, but we need to work with oncologists. The further out from a transplant that a transplant patient becomes, the more involved they are with their primary care physicians. But we need to communicate well and have a very efficient and collaborative relationship with your other care team. And then have a cadre of specialists when we need them. Gastroenterologists, to do endoscopic procedures, gynecologists who, understand the issues relevant to women who are on immunosuppression, a radiology team that understands the nuances of imaging in a transplant patient, urologists, for instance. We talked about kidney cancer in kidneys that don't work. Dermatologists that are savvy about immunosuppression. Because not every dermatologist or gynecologist or whatever specialist you have up there feels comfortable treating organ transplant recipients. So it's transplant centers should, and many do, have collaborative efforts with subspecialists at their institutions or outside of their institution whom they work with. So that when a problem arises, you have caregivers that are interested in this issue and want to have a positive impact on it. So this is important too. If you're asking questions, you're at all great centers. Some patients are, maybe at centers where they'll quickly get a feel for that's not a team that really has this set up. So in such a sophisticated way, and I think in 2015 this is critical. If you're going to do organ transplant, you have to have a whole large team there to support a patient after. All right, well, something a little light here, but the idea here is that you need to get screened and see physicians who do the screening.